Hey guys, Nick the Nurse here. Today we're going to be talking about the signs and symptoms of cardiac tamponade, or tamponade, tomato, tomato. Anyway, the number one sign or symptom that you have to know, it's a must know, when you're studying for the NCLEX or for your nursing school exams, if you see cardiac tamponade listed in the question, the first thing you should think about is Pulsus paradoxus. And why is that? Okay, and, you know, there's certain things on the NCLEX or on nursing school exams that you really shouldn't even have to think about. They should just be routine. It should be like habit. They should be like, you know, what's 2 plus 2? It's 4. You should have this memorized. When you see cardiac tamponade, you should think Pulsus paradoxus. Why? Because that's the number one sign or symptom associated with cardiac tamponade. They go together like peanut butter and jelly, like chocolate milk and toast. Well, maybe not. Okay, I like chocolate milk and toast. Anyway, other signs and symptoms include hypotension, tachypnea or rapid breathing, diaphoresis, muffled heart sounds. Muffled heart sounds are another one that aren't quite as seen as highly on exams as Pulsus paradoxus, but muffled heart sounds are up there. It's probably a close second. So remember Pulsus paradoxus and then muffled heart sounds. Anxiety, right? Because you're going to have an accumulation of fluid in the outer linings of the heart. It's going to constrict. You're going to see a patient who has some pretty bad anxiety. Elevated central venous pressure or CVP, restlessness, right? That goes along with the anxiety. You would probably be pretty restless too if you had fluid that was accumulating around your heart and didn't allow it to beat the way it should. I know I would. Tachycardia and jugular vein distension, right? You're going to see JVD. JVD is probably a close third. So if you had to rank them, and a narrow pulse pressure is number 4. So we listed quite a few signs and symptoms of cardiac tamponade, but if I had to list 4, okay, that I needed to know if for any cardiac tamponade sign or symptom, you know, thing that comes up on nursing school exams or on the NCLEX, I would know. Number 1, Pulsus paradoxus, right? Number 2, okay, muffled heart sounds. Number 3, jugular vein distension. And number 4, narrow pulse pressure. Now, as a good nursing student, okay, and student of all things A and P, you know that narrow pulse pressure is when you have the systolic blood pressure and the diastolic blood pressure. And when it begins to narrow, the numbers come together. You're not going to see 120 over 80. You're going to see numbers that are much closer together. That is not good. So if we see again, Pulsus paradoxus, muffled heart sounds, jugular vein distension, and narrow pulse pressure, you need to automatically think cardiac tamponade. And if you can remember those things, and the other things we talked about too, but really those 4 things, those come up more frequently than any other signs and symptoms on nursing school exams and probably on the NCLEX. Again, my name's Nick the Nurse. I appreciate you watching this video. I hope you'll watch my other videos at nickthenurse.com. Thank you for joining us. We'll see you next time.